Yo, yo, yo. Hey, guys, welcome back to another amazing edition of the Best Practices Show podcast. Our jam here is to bring the best speakers, the best teachers, best thinkers anywhere in the world to help you think better about dentistry so you can create a better practice and a better life. And today we're going to do just that. In our ongoing series with Dr. Coachman, he brings on an amazing guest, Dr. Rick Roblee. And they talk about ideal dentistry and the importance of comprehensive care and how we have to think bigger and better to truly help our patients right now and in the future. It is awesome. So please listen up. I hope you guys enjoy this, and we'll see you soon.
And we are back with Coffee Break with Coachman, with me, Christian, and some of the most brilliant minds of dentistry worldwide, really trying to leverage the amazing network that dentistry gave me almost as a gift to bring these thought leaders to you and hopefully through their vision, through their experiences, give you the insights to increase the chances of succeeding in this amazing but very challenging world that is the dental world. And today we have one of our main mentors, one of my main mentors. Actually, I would say the mentor of my main mentor. My main mentor is my father in dentistry. He's also a dentist. And since I was young, starting in dentistry, he told me my main mentor is Dr. Rick Roblee. And here I am with Rick. We were able to reconnect after many years. When I first heard about you, Rick, was around 1993, 1994. My father, recently coming back from US at that time, very few Brazilians would go to US on congresses, and he was coming back with your book. Mm-hmm. And he told me, I was on first year of dental school, he told me, this book will change dentistry, and this is my dental Bible. My father ended up translating the whole book into Portuguese and building his whole philosophy based on your book, Rick Roblee, dental facial, interdisciplinary therapy. For me, as I started to lecture, I always mention you as the father of interdisciplinary modern dentistry. That's my vision. That's my perspective. And I always refer to you as the one who allowed my dad to build one of the most successful interdisciplinary practices in Brazil. And as you know, dentistry in Brazil became very evolved. And my father is still running one of the most successful interdisciplinary practices there. And everything we do over there in Brazil is based on that book. And I tell my students still today, if you read that book, it looks like it was written 5 years ago, not 30 years ago. It's unbelievable how pioneering and visionary your book was. So for me, it's a great honor to have you, and I'm sure that our listeners will learn insights that will change forever their perspective in dentistry. Basically, what I want to talk here is about what means modern dentistry. What means ideal dentistry? What is ideal dentistry? What means moving towards ideal in your perspective? So to start, I want you and we're going to go back in time and discuss your journey and the phases and many techniques and tools and treatments and so on. But I want to start with this question to you. What means ideal dentistry today for you?
Thank you, Coachman. And It's so nice to be with you, Christian. This is truly an honor, and I love the story about how we connected. And just a little side note, I remember the first time I lectured in Brazil was sometime in the 90s, and I had heard about you from several people. You got to see this new star. He's on fire. And then I heard that Christian Coachman was looking for me because he said I was one of his main mentors, and I hadn't even met you. So, and then we connected, and it's been a great relationship ever since. So, you're the caretaker for interdisciplinary dentistry going forward, especially in the dawn of digital and now AI. I'm so excited to see what you're going to do on AI. But as far as, dentistry and having been in this a while, hopefully at a high level, my philosophies have changed a lot. And especially what I see now, I look at things differently. And, in fact, I look at teeth, and this is something I think that's really important because I think dentistry and medicine, we're all trained to treat symptoms. Okay. Mm-hmm. And the bottom line is we need to figure out why things are not right. Okay. And I look at teeth now, even in malocclusion, I'm an orthodontist. I look at a malocclusion. I don't look at the teeth as the problem. I look at them as symptoms because teeth are along for the ride. They're victims. Mm-hmm. They are victims. They're where they're supposed to be. They're broken down for different reasons. We need to figure out why they're in that relationship. Okay. Too often, all of us in dentistry jump in and treat teeth. Okay. And really, they're victims. And so this is where, especially the new approach, what we call Be Well for airway and overall health, has changed radically. I never dreamed that we'd be treating and helping people with major underlying health issues, improving the quality and quantity of their life. And, making them radically more beautiful at the same time. It's, I have to pinch myself all the time. But this is where, when comprehensive dentistry, state of the art today is to treat the right problems. And when it comes to malocclusions and what we do, the problem's not that they have too many teeth. We know that, from our studies with our ancestors, we didn't have this. It's the problem is epigenetics and how we're changing. And those same changes, epigenetic in the skeletal base that we work in, okay, leads to other more important health issues. And so this has really been a great segue into it. But this is where we break things down into what we call the fundamental components of what are the real problems. Okay. And so I think that's going forward. The concept with interdisciplinary is really addressing.
You're basically saying that, if I can translate what you're saying or interpret what you're saying that ideal dentistry, great dentistry today, the traditional great dentistry compared to where we are moving, it's all about deep diving more into where the problem is actually starting, right?
Correct.
And not treating the symptoms, but understanding the causes, right? Mm-hmm. And I created actually a sentence that people like actually, and I use it in my lectures, that was inspired by what I learned from you. And I say, aesthetics should never be the priority, but the beautiful consequence of the right treatment. This was inspired on everything I learned from you. And you mentioned to me once, every patient is an airway patient until proven innocent. I loved that one. Everybody in the crowd always loves that when you say it and when I repeat it. And
there's one second half to that.
Yeah.
And that is, and if they're proven innocent, then we treat them as someone who's going to develop airway problems, because they probably will with age.
We're going to treat them as if they're going to commit that crime later on.
That's exactly right. And and the bottom line is what we're treating is to more of our genetic potential and for function, form and function and habits. And the more better we do that, that is drop dead gorgeous, beautiful. That's where we're supposed to be. Okay. And so it's just a beautiful combination.
And why do you think this sounds so obvious, that the mouth and the body are connected, then the oral environment and systemic health is one thing. That treating only teeth is not treating the underlying problem. This sounds so obvious, and why professionals, they fight so much against it? Why do you think that happens?
Well, I think it's because the way we're trained. We're trained, especially in dentistry, but medicine's the same. I see it all the time in medicine. People are treating symptoms without looking at really what the underlying problem is. And, especially in dentistry, we love teeth. We love to do, restorative. We love to do all the different things. But if the tooth is not in a stable relationship, and if the habits aren't correct, and if the skeletal structure is not correct, we're committed to a lifetime of problems and continued maintenance on this, because we didn't address really why it was a problem to begin with. Okay.
Why do you think dentistry is so focused on treating and so not focused on diagnosing? And how can we change that?
Well, basically that's what we get paid for, okay, is treating teeth. And so a lot of it's driven by what we're going to get insurance payment on. And I hate to say that, but that's the reality of it. We don't get paid properly for proper diagnosis, okay? And I accepted that a long time ago. And my diagnosis, I do a complete workup, CBCT, photos, scans, an hour of my time consulting, and I don't charge anything, okay? Mm-hmm. That's my loss leader, because if I don't spend that time, or if I charged what it was worth, okay, I wouldn't be treating these cases. And so I kind of look at it as a loss leader, and that kind of took that pressure off my back of thinking that I'm not getting paid for it. We just made it a loss leader. And that way it's easy for my team to refer patients to me.
It's like an investment.
It's an investment. Correct.
It's like investing on marketing to grow your practice.
Right. And that's one of the big principles in my book way back when, is that if you're looking at diagnosis and treatment planning as a profit center, you're not going to be doing many big cases, okay, because you're not going to get them. And so we actually have an agreement, me and my team and the other specialists, where if we charge anything, it's dirt cheap. We don't want anything to get in the way for me getting the patient to another team member to do what we call dental facial counseling. That's going to do a deeper dive and reiterate what we've already talked about and support what we're talking about. It's progressive with each different team member, needs to be educating the patient on the same wavelength. But if we start getting, hunkered down saying, well, I'm not getting paid for that, well, then you're not going to, the cases are going to be relatively few. Mm-hmm.
And you have a successful practice. So it gives hope to all of us out there to believe that there is a way to have a great lifestyle by doing ideal modern dentistry, comprehensive dentistry, right?
Absolutely. Mm-hmm.
Investing in diagnosis can provide you with a good financially healthy dental practice.
Mm-hmm. Absolutely. Yeah, I've done that since day one, and it's worked well.
You mentioned that your philosophy changed a lot with time, of course, but you had this idea or this passion for comprehensive care since '93 when you wrote your book. Mm-hmm. You were probably like 30 something. I don't know. You were super young.
Yeah, I was 34, I think. So,
yeah, go ahead.
Well, I was going to say, that's why I practiced restorative dentistry at a high level. And lectured internationally on restorative dentistry. And then I decided, and I was already teaching some pros and stuff like that. So I wanted to specialize. And I thought, yeah, I could go into pros, which I love. I did all my own lab work and everything else. I thought, where can I make the biggest difference? And that was orthodontics, because the best cases I had done up until that point were cases where I worked with an orthodontist that actually listened to me. Mm-hmm. And learned from me, and together I learned from them, and those were my best cases, from a restorative standpoint. And so I decided to go into ortho, and that's really where the interdisciplinary, and we had a team in Dallas that was amazing. Pat Allen, Tom Wilson, Frank Higginbottom, me, Larry Wolfer, all these amazing people, and everything we did worked. And then when I graduated from ortho, decided to move back to Fayetteville, Arkansas, which is home for us. We didn't have an aerospray team. And so that's why I wrote the book. That was my kind of my how-to to myself and to my team on how we can establish something where there was nothing significant except for some amazing dentists that weren't working together. Okay. So that's how the book all came about.
Now, we here at the DSD Planning Center, of course, we receive hundreds of cases from dentists from all over the world, and our job is to try to help them treatment plan better. That's our main job here, to try to help them make better decisions, right? Using technology and using our collective intelligence and interdisciplinary expertise, giving insights, reports, and trying to make dentists make better decisions. And I don't know if you agree here, but from our empirical experience, right? There's no scientific research on this, but from our experience here, usually 2/3 of the restorative cases could benefit from ortho before restorations. Do you see similar numbers or different numbers?
Absolutely. Yeah, absolutely.
And so that brings me to another sentence that I shared, and I want your opinion. And people went crazy. It really went viral. I was not expecting. I posted this a few months ago, and I said, it's easier to sell the wrong dentistry than it is to perform the right dentistry. And that first impression about this sentence.
I love it. I love it. And because that's what the patient wants to hear, is some simple means that's going to fix their problem. Okay. They don't understand that problem is a symptom of something that's radically more important. So I think that's a beautiful way. And I think that's really sums up a lot of the problem we have in the interdisciplinary approach, is that is the simplest way to sell dentistry.
So the reason why I say this, and that brings me to the question, is that since we love comprehensive, we love the right dentistry, we really love diagnosis, we love treatment planning, and as you said, there's no solid business model supporting doctors that love that part. Unfortunately, the whole business model of dentistry is supporting treating and executing, meaning people pay more when you start doing the wrong thing. People pay you more when you start the death cycle of the tooth, when you harm the tooth, when you extract unnecessary tooth, when you trim down unnecessary enamel, when you don't diagnose and plan properly. That's usually when you make more money. And my goal is, how can we find a business model that is successful for the people that are doing the right thing or are trying to do the right thing, that is diagnosis and planning and comprehensive care, systemic care, etc. So my question is, you went through this process because you were making money as a great prosthodontist, and suddenly you started to move into convincing patients, wait a minute, we need to do ortho before prosto. And then you went even deeper. Wait a minute, we need to treat your airway before we even plan our orthodontics, or we need to plan our orthodontics towards airway, meaning that we probably need to do complex ortho and not simple ortho, meaning you are constantly pushing yourself and the patient against the shortcut, right? And correct. You probably developed a strategy of storytelling, of making patients value that. So what can you tell doctors that are passionate about doing the right thing but are struggling to convince people to value that?
That's a great question. And I'm fortunate where I practice with my two sons. So I'm able to spend a lot more time in consultations now. And I love that time because like you, I'm a teacher and a storyteller. And so I've really revamped the way I talk to patients, okay? Because they'll come in wanting something simplistic with some aligners or something. And And then I start saying, that they've severe fatigue, they're waking up, all these different things that are, aligned with upper airway resistance problems. Okay. And you start thinking all of a sudden this has gone from a simple aligner case now to a MARPE, maybe SFOT type thing. How do you make that transition?
Just a parenthesis here. You're talking to a patient that thinks that they're going to come to you, will do 2 months of aligners, 2 appointments, 6 veneers, and fix all the problems of the world. And suddenly you have to say, wait a minute, I'm talking about 1 year of ortho, I'm talking about surgery, SFOT, and all these extra things. And then you need to sell that story in a way that the patient not only will do it, but will love you because you convinced them to do it.
Correct. Okay, so I'm going to tell you a few of my lines like you have that have worked for me. And because you're right, they're expecting something simplistic. They don't want to hear the complex stuff. And they don't really know they have these potential medical problems. Okay. Yeah. And so the first thing I do when I sit down, I welcome them and say a little bit about them. And I say, you know what, we've been doing this for a long time. And we kind of look at dental problems differently. Okay. We look at them not as the problem, but we look at them as symptoms of other problems. Okay. And so I'm going to be asking you a lot of questions that may not seem like they're part of dentistry. In fact, you probably didn't even answer them correctly on the form because you didn't think that was something important, but it is. And so, what we look at teeth as along for the ride. And they're in the position, relationship, malocclusions for other reasons that aren't dental problems. And those other problems can lead to significant health and quality of life issues. Okay. So we want to give you the opportunity to get the best of all worlds. Okay. And, and so with that in mind, if I had a magic wand, what would you have me do for you? Okay. And what would you have me accomplish? And then they'll say, well, I want my teeth straight or whatever. Or, you know what? My dentist did tell me, that I'm clenching my teeth and I'm waking up, I'm fatigued, and start opening that. So, that's kind of how I open it. Yeah. And I do a deep dive. And especially when it comes to overall health issues, a lot of times, if you handle it right, it's, I frequently people will break down in tears because for the first time, somebody's looking at these symptoms and not thinking they're crazy. Okay. Yes. And they all of a sudden their problems are legitimate. Okay. And so I story tell and walk them through why. I do is explain and I teach just like you do. But the other thing I do that I think is really good, and I said, you came in here to get your lower front teeth straight. And we can do that. That's an option. Okay. And, just some aligners, maybe a little bit of polishing, and we can have you in and out in 9 months. And that's an option, but I'm not doing my job if I don't show you what else can be done. And let me tell you something. The most profitable thing I can do to help you is that easy case. Okay. I'm not trying to talk you into something because I'm trying to do more work for you. The only reason I'm doing that is because I want to be the best healthcare professional I can for you. But if you want me to do the basic stuff, I can do that as long as you understand what you're saying. No, I kind of defuse the situation like that. It really seems
I love that. I love that you up front, you tell the patient that if you decide to do the right thing, I'm going to be happier, but I'm probably going to make less money.
Correct. And that's true.
Still, I will be happier. And I'm here to convince you to do the right thing for you that is not necessarily the more profitable for me. Right? And you destroy that sensation, that over-treatment and overselling and things like that.
Correct. That has worked very well for us. And our case acceptance is really high. And that's because of that. And the other thing is, this is our 33rd year for our study club. Sometime I want you to do a common knowledge forum for us or something up for it. But 33 years we've been doing it, and we meet during the weekday, and it's always custom. There's no canned stuff in it, but that is our training ground. Okay, this is our grassroots effort to see who in the dental community, really is passionate about doing high level care. Okay, and so that's our gateway to get people in and develop them. But really, where the rubber meets the pavement for us and my interdisciplinary team. And the reason I'm saying this is because the more plugged in my team is, makes my teaching and selling the case so much easier, because now we have team members that are passionate about it, that are selling it before they even get here. Okay, and so that is a huge asset for what we have. We have an amazing team. But we're saying where the rubber meets the pavement for these team members is our Thursday morning meetings. Every Thursday morning from 6:45 to 8, we have we'll do diagnosis and treatment planning on probably 8 different cases, and different doctors will dial in depending on who's on the team. And we have doctors from Tokyo and Dallas and everything else chime in just to learn. And it's cases that are in treatment at certain snippets, and it's a very powerful learning and teaching tool.
This should be broadcasted to the whole world of dentistry.
I mean, anybody who jumps on thinks this is the best CE we've had, and everybody gives their opinion, even if they're not part of that team. Because every patient, we don't have the same people on every team. We have multiple different specialists that we work with restorative dentists. So that's where the systematic approach to really doing this diagnosis treatment plan is so critical.
Yeah, of course, I'm not an expert on airway. I'm not an expert on systemic health at all, but I'm just passionate about trying to connect the dots. I'm passionate about following the people that are treating the big picture physicians, the big picture dentists, or as I call the super generalists, and how we have an excess of super specialists and a lack of super generalists. And people just dive into the detail of the detail of the detail and don't see exactly what you're saying, where the core of the problem, the beginning of the problem, and at least educating patients, even if you're going to do what everybody else would do, educating the patient to allow the patient to have a conscious decision about what they want to do, right? Moving the patient from that easy, superficial, instant gratification. That is the problem of humankind in so many areas, right? Modern society, instant gratification, and the medical world is just making it worse with the way we treat people. And aesthetics is making it worse, because then people sell the idea that by treating aesthetics, you're healthier, when it should be the opposite. And doctors make more money by pushing people for the instant gratification, avoiding the real treatments. From all these connections that are missing, I've been researching first, I started to learn a lot about airway and the missing link between dentistry and airway. And you're definitely one of my main mentors on this topic. There's other more biological missing links, the impact of chronic infection in the mouth and systemic health. The impact of chronic inflammation in the mouth and systemic health. The impact of bite and posture and chronic pain, for example, and airway. For me, these are the 4 major areas that, at least for me, is what I'm trying to see a little bit beyond. You really deep dive into airway. When that started, why that started, and why do you put airway as one of the core pillars of modern dentistry?
Excellent question. Let's kind of backtrack on that for a little bit. And a lot of it has to do, from years of discovery and, experience. And it's not, you don't learn from experience, you learn from scientifically analyzing your experience and seeing how you can improve. Okay. That's what you're like. That's what I like. And so we're on this journey trying to improve everything we do. And the more you do dentistry, the more you see that there are factors that, are out of your control. And that if you don't, especially an orthodontist, with relapse, okay, you start looking at your cases that relapse, I think there's something else going on here, okay, that we treated symptoms by moving the teeth. The problem may have been, lack of bone, which is rampant, okay? Every generation, our skeletal structures in our lower face are getting smaller. But also the neuromuscular, the muscular component, because the teeth are where they need to be in equilibrium with all the different stresses and forces. And if we don't jump into that, we're going to get in trouble. And, the bottom line is, we're genetically programmed. The skeletal components, the dental components, and the tongue are all genetically programmed to work and be compatible with each other. And so genetically, the tongue and the teeth don't change. The skeletal structures are highly influenced by the environment epigenetically. And that's what's really changed, in my opinion, the way I look at patients now. And that epigenetic change in the skeletal structures, where the teeth and the bone are totally subservient to muscular function, or more importantly, dysfunction. And if we start trying to treat the teeth without addressing that, we're going to have major relapse. Okay. And that's why we've talked about this before, how now I don't talk about airway necessarily with the patient either. I don't like to talk about it in lectures because there's so much misinformation out there, and there's so much money being thrown into different appliances and techniques that are destroying. I get to see all the problem patients, good or bad, and there's a lot of misinformation out there, and so that's why we don't talk about airway basically by using that term. What we talk about is wellness, okay, and that's where you and I have talked before about the Be Well grid. Yeah. And this is really important. And it hits on, when I'm trying to educate dentists, it hits home with the patients, okay? And what the Be Well concept is, and I'm really proud of it because it really just hammers with the question you're asking home and going into the future, is we are all driven and motivated by beauty and aesthetics, okay? That's what motivates us. It motivates our staff. More importantly, it motivates the patient to do the things that we need to do as healthcare professionals. Okay, we can use aesthetics. Okay, and so beauty has always been a part of it. The problem is we're not treating the right structures and the right underlying, components of the problems. We're going to have problems, and we're going to miss some really advantageous things to help the patient with. And so that's why in the Be Well grid we have beauty on one side, and on the other side of the chart we have wellness. Okay. And beauty stands for, in this concept, anything within our capacity as dentists, working with our counterparts in dentistry and medicine, that can improve the beauty of the patient. Okay. Plus, and this is what's totally underestimated in airway and wellness, is the effects of wellness on beauty. And when you see these patients that have these beautiful smiles, but then you look and their eyes are bright, their complexion's beautiful, they don't have, the Venus pooling under their eyes, that elevates the beauty. But on the other side, we have wellness. And wellness includes all the things that, we have been trained, the perio, the dental, all the different structures that we've been trained, which is so important, especially now, like you said, we know about the inflammatory process and how it can affect wellness overall, but also the effects of airway being treated on how it affects wellness overall. And that's where we see some radical changes and improvements. And so we have to be going, and we break it down into negative, neutral, positive, and then optimal. Up in the right-hand corner is the optimal. And, the upper quarter is what we call the target zone. And that's where we've improved not only beauty, but wellness to a new level. And
Yeah.
what's fun is going back and look at all the cases I've been teaching for years and published, and I put them on that chart, and by God, it's not
You missed
good.
You
I missed
some
it.
opportunity.
I missed
It's a miss of what you teach on your lecture is the opportunity that was missed, right? We missed the opportunity. We can do a superficial treatment and make patients' smiles look better. That's very easy. You put 10 veneers and everybody will look a little bit better. It's what I call superficial beauty, or immediate satisfaction with beauty, right? And what we are talking about here is that when you generate longevity, when you generate wellness, you have a longevity beauty, as we can say, meaning beauty that will last much longer because it's a consequence. It was the initial priority of the patient because we are all driven by beauty, but it was not the first focus of the healthcare provider. The healthcare provider was able to sell this idea that if we do the right thing, if we treat the right problem, if we diagnose the right problem and do the right thing, you're going to have this beautiful collateral effect that is becoming really more beautiful and for many more years, right? And I love your grit. Yeah.
And your dentistry is going to hold up better because you've addressed why they had problems to begin with.
Yeah. Stability. It's stable, right? It's stable because you said when you try to move things superficially, the whole body will work against it, right? And it just came to my mind that you said, as you were saying, that the soft tissues are kind of guiding the hard tissues on the development, right? It's not the opposite.
Absolutely, yes.
Soft tissues are guiding, and soft tissues are working daily, day after day, millions of seconds and minutes, moment after moment. Soft tissue is working in a certain way, back and forth, and molding the hard tissues. And then we want to change the hard tissues without addressing the problem. And for me, airway, as you were saying, why do we focus on airway? What is actually guiding the soft tissues every second of our life is breathing. The only thing that it's the heartbeat and the breathing. There's nothing else that happens so consistently over and over again. And in this part of our body where we take care of, breathing happens here, and it's happening constantly on the wrong way with the wrong structure, right? And it's guiding everything else. So it's very obvious if you think holistically, right?
No, you're exactly right. And so I do spend quite a bit of time talking about this because, the skeletal structures down here in our mid face and our lower face are highly adaptable, more than any other bones in the body. Okay. And that's why epigenetic changes are so common here. And that's why we're getting smaller every generation because our diet's softer. And this is, all proven with dental pathologists. And so we don't even need to go there. We're getting smaller. And the bottom line is the skeletal structures of the lower face are a lot like the orbits of the eyes and the cranium. Okay. The cranium and the orbits don't form in the eyes film and the brain film. It's the opposite. For the orbits, the eyes form, the muscles form, and then the orbits form to not only house the eyes, but support the function. And if that function changes, the bone changes, because when it comes to muscle and soft tissue versus teeth and bone, muscle and soft tissue win 100% of the time. The bone is meant to support. And so you're going to develop, if you're a mouth breather, you're skeletally going to develop to be a mouth breather. The long face, the deficient, the constriction. And this is why it's so important to be looking at why and change that. And when you do that and you figure out that maybe they're mouth breathing and thrusting because they're trying to breathe and all the different things. And I guess the best way I like to sum it up is what we're doing now, and this team approach focusing on wellness is who else in medicine can treat major underlying health issues and make people more beautiful at the same time. Not just a little bit, but radically more beautiful than we ever thought we could. That's what the future is.
That's the
That's what
modern
future
dentist.
I've always loved what I do, but I'm getting up there in years and I have no plans of slowing down because I don't want to miss out on the fun, especially
No,
getting to do it with my sons.
you can't get a bigger purpose than that. Doing this type of dentistry, putting the effort and the courage to get outside the comfort zone and not do exactly what everybody else is doing. And I'm not pointing fingers and not blaming. I'm pretty sure a huge majority of dentists are trying to do their best and are ethically driven, putting their hearts into what they do. But what we see is a huge necessity to get out of your comfort zone and
it hurts.
Yeah.
It can hurt. And that's one of the problems we have in dentistry is for instance, as an orthodontist, I'm trained to take out teeth when severe crowding, and I've done thousands of those. Okay. I don't anymore, but that's what we were trained. And you look at it, the problem was not that they had too many teeth. The problem was that the skeletal structures were too small. And the science shows that taking out teeth and treating to the small bones doesn't cause airway problems. But what you've done is you've squandered a tremendous opportunity to change the quality and quantity of that patient's life by developing the skeletal structures. So I have to eat crow quite often, and I don't mind doing it. When a patient comes in, I've treated before, they still have beautiful results. I took out teeth, but they're suffering from, upper airway resistance, for instance. And then I got to eat crow and go in there. You know what? That was the best we could do, but now we know. And we work with it and we redo it and fix them. And so the problem is a lot of people don't want to change course because they don't want to admit that what they made their career on before now was not the right path. And that's hard.
That is the challenge. To have this humbleness and this strength and this confidence on the evolutionary process to be able to look back and say, I did my best, but now I can do better, right? And usually that happens a lot with speakers and teachers because they put so much energy developing a philosophy, developing a protocol, developing a technique, and they wrote articles and they did research to prove their idea. And now that they have something, sometimes we look back into everything we did and we said, it looks perfect, but it's not right.
No.
It's not right.
No.
And you have to kind of have this beginner's mind, right? And not be, it's the ego. You have to detach from what you did and say, let's just move forward. Let's evolve.
And even like, I've been fortunate where, getting to know and talk to people like Pete Dawson, he had to change his philosophies quite often. And I know that if he were still alive today, he would be 100% behind what we're doing now, even though it's not what he originally taught. Okay. But, the same is true with John Coyce and Frank Spear, all these greats that make their names on certain philosophies and techniques. They've got to be open to change and go forward with it. There's a lot, especially in dental education, that don't. Okay. And I see it a lot in ortho departments. And that's why when it comes to stuff like the wellness or the airway that we're talking about to be accepted in dentistry, we need a couple different things. The most important thing we need is scientific evidence to prove it. When that's one of the main blocks we have on the road to doing this. But sad, we not only need evidence, but it's going to take a few funerals too. Okay.
Yes.
To open the gates to where we can really do this consistently. Yes.
But everything that is proven now, scientifically proven now, was not proven a while back, right? So the same way we need to filter, we need to believe in science and we need to prove ideas. We also need to be open to explore things that are not proven and be courageous to go against criticism and people that are conservative, people that don't want to hear the new. On the other hand, another question that I have to you, because we know that happens in human history over and over again. You have a new idea, a few visionaries are trying to bring a new perception into something, you have everybody going against, but if these pioneers are strong enough, the idea persists, a couple more people join, you start to see results, maybe not scientifically proven results, but clinical results, more people join the movement, but then comes the moment where the story becomes good enough that opportunistic people jump in, charlatans jump in, people that decide to say that they found a solution for everything. And I believe that airway dentistry is at that moment now, where very serious people did very hard work to get to this point, and now suddenly everybody wants to talk about it, everybody wants to teach, everybody has a perfect device that solves all the problems. How do you see this moment in airway dentistry now, and how can people filter?
Well, I think your introduction to the question was perfect, okay, in that it's come to a certain degree. Now we have people jumping on, lots of charlatans, lots of money, okay, and there are all these magic devices that you can learn on a weekend course that the orthodontist just won't do, that are going to fix these problems. Well, if something sounds too good to be true, it is, okay, and so this is where we're having a lot of different issues. And why, especially in the big meetings like the Restorative Academy and the Aesthetic Academy that we both participate in, you have to be real careful what you say, because we don't have the evidence yet, and there's a lot of naysayers looking at it. But this is where, if you look at evidence-based dentistry, we live by that, and it's a scientific. You have to have scientific evidence. Okay, the other side of it is you need to fulfill the patient's needs and preferences. That's why we work so hard doing everything with clear aligners and doing aesthetic diastema control when we're doing MARPI, so they don't get the bit. All these things to satisfy that. But that middle one, and I touched on it earlier, is that clinical experience and expertise. We can't underestimate that. And so what I try to do, and I know my sons do, just like when I first saw corticotomies, there's a radical procedure that I thought was going to be junk, but I was open-minded enough to take my surgeon to take the course, and I saw some things there that looked beautiful. And so you take that, whatever scientific evidence you have, then you take the expertise and the experience you have, and you apply that. And, the old saying is some people look at experience as doing the same thing wrong over and over again with ever increasing confidence. Okay, that's where a lot of people's experience is. That's not what we're talking. We're talking about every time we do something, doing a deep dive and scientifically analyzing that experience, and how can you improve to push the science further, and then doing the records and having the database. And that's why, we've done, somewhere like 1,300 SFOTs with clear aligners. We've done over 1,000 MARPIs now. We're doing a couple a day. We're doing records so that the different universities can come in, take what we've done with scientific knowledge and a lot of experience and application to make it where we can prove that what we're doing is the best going forward for the masses. That's what it's going to take.
Now, I have a final question for you that you mentioned about the opportunistic people, magical devices that can treat all the situations and solve all the problems related to airway. Many patients are desperate, and when they hear that, they want to try whatever. Now, if you're a serious doctor and you want to learn serious procedures that are helping with airway, what is this new toolbox? And I know that you are one of the pioneers on creating protocols, interdisciplinary, comprehensive protocols. But if you could list quickly the procedures that you're doing more and more that are bringing great results, and you can take the opportunity to actually mention your course and the program that you're putting together to teach people all these procedures. So the new toolbox that a modern dentist needs to add to whatever we already knew was part of the toolbox that we needed.
Well, the first recommendation I have, and there's not a lot of good courses I can recommend for this, but is, try to take courses that are not product or technique driven. learn about the science of airway disorders, not apnea. You know, we don't focus on apnea because that's on the end of the spectrum. We're focusing on the upper airway resistance problems leading up to the apnea. Okay. But we need to learn enough about that so we can scientifically analyze the procedures and techniques that are coming at us. Mm-hmm. Okay. And if you don't have that background, you shouldn't be doing the techniques, in my opinion. Okay. So I think that's really important. Learn the science. And if something seems too good to be true, it probably is. You can't move teeth where there's not bone unless, like we do, and we teach in the course you're talking about, if you know, we harness growth and development as much as we can. I'm actually treating my grandkids at 3 or 4 at the latest, because we know they're going to be small arches. We're knocking that out because we're treating teeth, yes, okay, but the teeth are victims, okay, and the problems that they're going to have with the malocclusion and small arches are not dental problems. So we don't go on the dental development curve. We treat on the skeletal development curve, and which is almost done by age 7. Okay, and when you start really looking at that development, it can make a significant difference in a child's IQ if they're breathing properly and functioning properly. So we jump in, and you've had some experience with that yourself.
Yes.
But then you know, all the adults we treat, which is a huge part of my practice, no growth and development. What do we do? Because there's still small structures. And this is where, we can do radical orthognathics, what I'm a big fan of, but frequently that's going to be over treatment. So what we do is we harness the body's natural repair process to grow bone and soft tissue in a healthy standpoint. Okay. And that's what the MARPE does. Okay. The bone-borne skeletal expansion, and which has revolutionized our approach to not only health, but aesthetics. Okay. And so what we're doing is we're using sutural distraction osteogenesis to grow volumes of healthy bone and soft tissue, because the problem this patient has is lack of bone usually.
Yeah.
And the same is true with SFOT, surgically facilitated orthodontic therapy with corticotomies. We're harnessing the body's natural repair process to grow bone and move teeth where there's no bone and improve the periodontal phenotype. And those two things, and that's what our course is about. It's an interdisciplinary team approach towards MARPE, SFOT, and clear aligners in dentistry. And we really promote the team concept, which goes along with how we first introduced through my textbook, is we want the orthodontist, we want the restorative dentist, and we want the surgeon all to be there together and learn. Because if you're doing a lot of airway dentistry, and this is what my restorative dentists will tell you, their restorative practices blew up when we started treating airway, because we're doing a lot of space opening and other things that are leading to just really amazingly good conservative intraenamel restorative at the same time. And so we have to have the entire team there, because if I can get an orthodontist motivated, but if they don't have the surgeon, if they don't have the restorative dentist, it's going to fall apart.
This is a great way for patients to filter if they have a dentist that is saying that they're going to fix the airway problem in a non-interdisciplinary way. They're probably not going to fix the airway problem. If they don't have a natural interdisciplinary approach, there's no way you can treat airway with magical devices.
Right. And that goes back, again, from my textbook. You remember I differentiated inter from multi. Multi is working with different disciplines. Inter is working between the different disciplines as one cohesive unit. But then there's the unidisciplinary, somebody trying to do it all on their own.
Yeah.
And you're looking at somebody who drives himself crazy, is trying to stay up with all the different specialties and everything else. But the bottom line is, I need to know enough about it so that I can do my part, working with the right support. And And so, my recommendation is don't try to be the superstar unidisciplinary dentist. Work with an interdisciplinary team where all of you are at the top of your game in those different specialized parts. So we really promote it that way.
Become a superstar diagnostician, that for sure.
Correct.
And work with superstar specialists.
Correct. Absolutely.
And join Rick's course, because it is the best course. There's so many names for this style. You call it airway dentistry, but I think it's beyond. It's modern dentistry. The name modern dentistry is too, modern is used so many different ways. It's too cliche. People call physiologic dentistry, functional dentistry, biological dentistry, airway dentistry, wellness dentistry. Modern dentistry is just the right dentistry. That's why I mentioned is the ideal dentistry, is the only dentistry that should exist. And hopefully in the future, more and more people will have the courage to join this movement. So we are over 1 hour, Rick, so I don't want to take more of your precious time, and I want you to give a final message for everybody listening here to us, to inspire people to join us in this movement towards a more ideal, comprehensive dentistry.
Yes, a couple different quick points. One is, as I said, when it comes to airway, learn the science, not the techniques first. It's critically important. Understand what we're trying to do, why structure, function, and behavior is so critical to the process, and our anthropological norms with that. Okay, and the other point that I want to make is think of teeth as being along for the ride in victims, and they are symptoms of other really more important problems, which is hard for dentists to swallow. Okay, no pun intended. Right. And look at those teeth as the problems you're treating with the teeth as symptoms of other issues, and that's not only going to make your dentistry radically better and radically more beautiful, but you're going to have the opportunity to change the quality and quantity of those patients' lives like we never thought possible when we first got in dentistry. And it's so rewarding in all aspects. And so I think this is definitely going to be mainstay in the near future. But in the meantime, you keep spreading the word and doing your storytelling to get the word out there. Okay.
It's just beautiful. It's just beautiful to listen to you and to learn from you. And I'm really happy that you're back full power on the international lecturing circuit. So I'm pretty sure we're going to see each other soon somewhere, be able to brainstorm more, share, and learn more, and then hopefully come up with more ways to collaborate and work together, because it's so beautiful to follow your steps and to be inspired by your work.
Thank you, Christian, and you keep doing your amazing stuff. You're a great mouthpiece for all this and everything that we're talking about. So you please keep it up, okay?
I will try my best.
Okay.
Thank you so much, everybody. Hope you enjoyed.
Thank you.